Good afternoon. Thank you for joining us on Facebook Live. I am David Alvey, Mayor and CEO of the Unified Government of Wyandotte County, Kansas City, Kansas. With me today is Dr. Alan Greiner, Public Health Department's Chief Medical Officer serving Wyandotte County. We're here to do a couple things. First, to give you an update on the status of the COVID-19 virus here in Wyandotte County. And secondly, want to describe what we've done so far and how we're moving proactively to prevent the spread of this virus. So first, I'd ask Dr. Greiner to give us an update on COVID-19 cases in the area of the Unified Government.
Thank you, Mayor. Unfortunately, this morning, we confirmed 2 new cases of COVID-19, and end of this afternoon, we have another positive case. This brings the total number of cases in our county to 4. Both of the cases from this morning, we are Wyandotte County residents. One is a female in her 40s. The other is a female in her 50s. Both patients were admitted to separate local hospitals. Medical professionals at those hospitals consulted with the Kansas Department of Health and Environment and determined the need for COVID-19 screening. KDHE confirmed the positive test results late last evening. The patient confirmed this afternoon is a male under the age of 18. He is well enough to be isolating at home and is doing so according to the CDC guidelines. The patient is a student of a local private school. Public health officials are working closely with the private school in their investigation of this case. All schools in our county are currently closed, and more school-related recommendations are forthcoming later today. On behalf of all of our staff, I'd like to say that we hope all these patients make a complete and speedy recovery. The Unified Government Public Health Department will continue to conduct investigations in these cases. This is a process where we retrace the patient's steps and activities so that we can identify anyone who may have been potentially exposed to COVID-19. Seeing additional cases of COVID-19 in our county is a call to action for all of us. It's up to our community as a whole to reduce the spread of COVID-19 and to protect those in our community who are most vulnerable to serious illness. Here's what we're asking our residents to do. Avoid large gatherings. Practice social distancing by avoiding being closer than 6 feet to other people. If you're sick, please stay home. If you have symptoms of COVID-19, which include fever, cough, runny nose, shortness of breath, please call ahead before seeing your healthcare provider and stay home until you receive additional instructions from his or her office. If you think you may be needing testing for COVID-19, call your healthcare provider who will evaluate your symptoms and other factors that could indicate the need for testing, such as your travel history, and they will determine what is right for your care. Practice good hygiene, including hand washing for 20 seconds or using hand sanitizer. Avoid frequently touching your nose, eyes, or mouth, and clean, regularly touched surfaces on a daily basis. Also, it's important to realize that certain members of our community are more at risk from contracting COVID-19. This includes older adults, people with chronic health conditions such as heart conditions, diabetes, and lung disease, anyone who might be immunocompromised, including smokers, anyone with previously diagnosed respiratory issues. If you or a loved one is at higher risk for the illness, follow the latest CDC guidelines for people at higher risk. These include having adequate medications, food, and household supplies on hand, avoiding crowds, planning for what to do if your usual caregiver is sick or unavailable. Please note that wearing masks in public is not recommended for those who are trying to avoid infection. Lastly, please stay informed and help those around you do the same. We have several resources for you. The Unified Government's website at wykokck.org/COVID-19, or the Wyandotte County Helpline, which is also available at 311, and they will take your questions about COVID-19. The Kansas Department of Health and Environment also has a COVID hotline. That number is 866-534-3463. Or if you prefer, visit their website at kdheks.gov/coronavirus. One last note from me. In the future, new COVID cases will not be reported via media release. Instead, we will begin including these reports in regular case count updates that will be available to the Unified Government's COVID-19 webpage. Again, you can find this information at wicokck.org/COVID-19. For an update on the announcement that came out late yesterday concerning actions taken by the Core 4 city and county managers, I'm going to turn it back over to Mayor Alvey. Mayor?
Thank you, Dr. Greiner. And of course, as we all know, this is a very serious time. It's an extraordinary time. Our primary purpose here must be to flatten the curve. That is the number of new cases that are being reported. And so we are taking very serious measures to make sure that we get out in front of this and keep that curve from spiking. Because what we want to avoid is overwhelming our health system and not being able to provide the care that our people need. That's the same conversation that is happening at the national level. It's the same conversation that is happening at the global level. So I think it's important for our residents to understand the steps that we have taken and are taking, and really to describe the process by which we are moving forward to really confront this crisis. I want to mention that we have called together a robust group of institutions, anchor institutions across Wyandotte County, and that includes Providence Hospital, it includes KU Health System, University of Kansas Health System, it includes the mayor and city manager of Edwardsville, Mayor McTaggart, Mayor Harrington, and his city administrator. It includes the leaders of the parochial schools. It includes the leaders, the superintendents of the 4 main public school districts in Wyandotte County. We also have on this call Congresswoman Davids was on the call this afternoon. We also have representative from Senator Moran's office on this call, representatives of the Wyandotte Health Foundation, Wyandotte Behavioral Health Network, the Community College, Donnelly College. These anchor institutions, the leadership of these anchor institutions are coming together on a daily basis during the week to report the most recent developments and the actions they're taking in their institutions, but also to tell us what they need. And we are communicating to them what we have done and also asking their help in different ways. So this conversation has been extremely helpful for us, because I believe we're gathering the right information from across the county, and we're also putting the right decisions out there. In fact, the decision yesterday by the unified government to go with the Core 4 and to come up with a ban on restaurants and bars, or closing of bars and restaurants, really came out of consultation with that group. And of course, in all of these conversations, our public health officials take the lead. So that's really who is involved in the decision-making. It's not made by one individual or a few individuals. We have tried to broaden the scope of who is involved in this, and I think that's giving us a much more complete, coherent response. We did decide, as noted, to restrict all bars and restaurants to dine-in or delivery or carry-out only. That is for 15 days. And again, what we're trying to do is limit the spread of the virus. We also are limiting social gathering groups to no more than 10 individuals. We are, again, there are other actions that have been taken. The Archdiocese of Kansas City, Kansas, and Johnson County has canceled all services and masses. There'll be no public masses offered by the diocese. Well, we appreciate that move by the Archdiocese of Kansas City, Kansas. We also recommend all other churches to really consider holding services at this time until further notice, because, again, the risk of transmission. I would also let you know that the school districts in Wyandotte County have decided to keep classes, go offline and go on to online classes, or to close school, stay closed until April 6th. Now, there may be further decisions made at the state level. Again, the governor and the State Board of Education and the Secretary of Education for the state of Kansas, I know they're having continuing conversations about what to do for schools across Kansas. So there may be additional announcements coming from the state level, but at this point, Wyandotte County has decided, the school districts here decided, to go online, if possible, until April 6th, and to keep the students out of schools. I think it's also important for you to know that for those folks out there, BPU customers, the Kansas City Board of Public Utilities has temporarily suspended all utility disconnects, that is for water and for electricity. They also encourage you to go online as much as possible, or get on the phone to call the BPU. If you normally come into the lobby, we discourage you coming into the lobby. You still can do that, but they ask that you try and do this online. And if you have any questions about that, just simply go to bpu.com. Our public health department has been the primary lead in our community. We're utilizing their expertise in health, and they're also in conversation with federal and state agencies and private sector expertise. So we're also in contact with our health foundations and with our community providers to make sure that they tell us what they need, and that we're trying to get the resources that they need in order to provide care for our residents. I would also say that in addition to the conference call that includes the institutions across Wyandotte County, every day, and this includes Saturdays and Sundays, internal operations, which includes fire and police and the health department and livable neighborhoods and all the major outward-facing departments of the city, we gather together to discuss what we need to be doing, internal operations, to make sure we continue to provide our residents with the services that they need and they deserve. We have a dedicated unified government web page and resource book. That's wicokck.org, and all things COVID-19. We have links to the Kansas Department of Health and Environment, to the Centers for Disease Control. We have recommended actions. We have the background. The information you need is there. We also have on there a UG action summary so that you can go on as a resident and see the actions the unified government has already taken. I think it's important for us at this time. I've noticed on social media some of the stuff that is being said out there. It's simply a lack of information. Either people are not going to the source to get the accurate information, or they simply want to ignore it. That lack of information or that misinformation is damaging. We have to take responsibility as citizens to make sure we access that information. And if you hear someone saying something that just doesn't sound right, that makes it sound as if we are being irresponsible in this, I think you need to refer them to the wicokck.org website so that they can see for themselves, access that information for themselves. It's very important that we share accurate information and we share it in a timely way, and that's what we're trying to do. I will also say that simple things we've already done that are major tasks, but we had to do these. We did declare a state of emergency. That allowed us to, first of all, more easily access resources, both material and financial, for flattening the curve on the virus, stopping transmission, but also to provide necessary treatment. We've made changes to our municipal court. We have instituted police safe practice measures. We, again, had a local health officer restrict large gatherings. And as I said yesterday, we had the Core 4 come together. Core 4 is the leadership of Wyandotte, Jackson, and Johnson County, Johnson and Wyandotte in Kansas, Jackson in Missouri. Then include Mayor Lucas, County Executive Frank White of Jackson County, Chairman Ed Leitert of Johnson County. We came together to have a common policy on prohibiting bars and restaurants for opening, because we did not want to send a mixed message, and we wanted to make sure that people understood that, if you could not find a bar or restaurant in Wyandotte County, you might think you'd go to Johnson County or to Jackson County. We wanted a common practice, a common measure, because we think we have to do these things to halt the transmission of this virus. So again, I recommend everyone go to the website. We're going to keep that updated. We're going to keep putting the information out there that our residents need to see. That's important information. If you have questions, feel free to call. We're going to take those calls. We're going to respond to them. And we know we decided that we were going to prohibit bars and restaurants. We knew what a hit that would be on our businesses, especially those who depend upon that for their livelihood. And we are working on solutions to that in conversation with Congresswoman Davids. They're looking at this kind of some legislation at the national level. Senator Moran from the Senate side said the same thing. Actually, there is a form you can get to if you go to the Kansas Department of Commerce. If you're a small business, go to the form about, as a small business, how could you access financial resources through this time? Here's a copy of it, but if you want to go to the website, you're going to find a link to that. Again, as you know, last Friday I signed a state of emergency for Wyandotte County, and I was able to do that under my authority for up to 7 days. But in order to extend that declaration, I will be calling a special commission meeting for this Thursday, March 19th at 5:00 p.m., and I will request our full governing body to make a state of emergency declaration that will take us another 60 days, and that's required by statute. And additionally, our governing body will convene that evening as our Board of Health for the county to receive an update from the Health Department regarding COVID-19. So this session on Thursday will be open to the public and available on UGTV and YouTube. Again, we are discouraging people from congregating in one place, any gatherings more than 10. I encourage people, simply reach out to your neighbors. There are people who may not have access to the internet, especially our elderly. They're going to feel more isolated, and I think it's important for neighbors just to give a call. Just check in on your neighbors, see how they're doing, see if they need any questions answered. If they're not able to access, they don't feel comfortable going on the internet, do that for them and get that information back to them. I think it's really an opportunity for us, a time for us to reach out and make sure we're taking care of our neighbor next door. So having said all that, I'm going to, we'll take some questions on Facebook Live.
Thank you, Mayor. Hello, my name is Janelle Friesen. I'm the Public Information Officer for the Unified Government Public Health Department, and I'm going to take a few questions that we've been getting on Facebook Live and that we've been hearing frequently lately. So the first question is for Dr. Greiner. Why is wearing masks not recommended for the general public?
So the primary reason we don't recommend masks for the general public is that we don't have evidence from the original countries where the outbreak occurred, such as China, South Korea, other places, that those made a significant impact on spread. Masks can be difficult to wear properly, and we believe people that are wearing them should be trained to wear them. So in the healthcare fields and the public health field, we are all trained to wear those masks properly. We worry that if people are using those masks without training, they might use them inappropriately and they'd feel a sense of security that wasn't justified. We don't want that to lead to problems, so we really discourage use of those masks by the general public to try to avoid infection.
All right, our next question is, what exactly is social distancing and why is it so important?
I can take that one as well. Social distancing is really the idea that you need to stay away from others, especially others that you don't know, and you would have no way of knowing if they might be symptomatic or might be infected. So creating distance between yourself and others whenever you're in public. So for example, if you're going to the grocery store, and those are places that we know will need to stay open because people will need to purchase foods and household supplies, we encourage people to try to stay 6 feet away from other people while you're doing your shopping and while you're doing your checking out. That's what we're trying to do here at the podium today as well. So think about staying at a distance of 6 feet away from folks, and really think about staying home, especially if you're in those high-risk groups we talked about, or especially even more so if you're sick and have any symptoms like fever, cough.
And Mayor Alvey, how did social distancing recommendations factor into the recent decisions and recommendations that the UG has made?
Yes, thank you. That's an excellent question. Obviously, when I was thinking, for instance, March 17th is one of my favorite days because it's St. Patrick's Day, and I usually find myself at Brits on 5th Street. And being at Brits, if you've been there on St. Patrick's Day, you know that you are can't even get 6 feet away from anything. So you're going to be right up against someone. So it was important for us to try and prevent these concentrated gatherings of people. And so that was an important consideration. And obviously, if we can keep people, not have gatherings like that, it's much easier to accomplish social distancing. So this is why, for instance, Dr. Greiner is sitting over there, and I'm sitting here, and you're sitting there. We're trying to model that practice of social distancing.
Thank you. Another question for Dr. Greiner. Can people be contagious if they're not having symptoms?
So that's been a fairly controversial topic in the scientific literature that's been coming out about COVID-19. As you know, it's a new, relatively new illness to the human population, and we don't know everything. We're learning something new every day. There have been recent scientific articles just in the last 3 days that suggest that asymptomatic individuals could potentially transmit it to others. We really don't know, and we're really waiting on more information out of China. There have been some really nice studies done, but until we get enough of those studies, we won't really have conclusive evidence. Again, we suggest that social distancing from anyone, whether they are symptomatic or not. I think the safe route is to assume that anyone could potentially be infected and anyone could protect you. So those universal precautions of that social distancing are super important, in addition to the hygiene items like washing your hands and try not to touch your face, eyes, and mouth.
Okay, another question for you, Dr. Greiner. Just a broader question. What do you think are the biggest misconceptions around COVID-19?
Well, there's a lot, and the information is moving fast. I saw another study just this afternoon that found conclusively that the virus originated in China. There have been misconceptions about whether the virus could have initiated or moved to the human population in another country. That's a misconception. The idea about wearing masks to protect yourself from infection is another item that I think people are uninformed about, the fact that that's very unlikely to protect you. I think some people feel like this whole issue is overblown and that we've taken it way too seriously. I feel like that's a misconception. I think we've got historical data from other pandemics that really strongly suggests that you can save a lot of lives if you take action early and like Mayor Alvey said, try to limit spread and flatten the curve of this disease. So those are some of the big misconceptions that I've seen.
All right, and just to wrap this up, Mayor, is there anything else you would like Wyandotte County residents to know?
Well, again, what I really want our residents to understand is that, this is such a fluid situation, and what we've decided to do is let's look at the experience that we've already seen occur in China and Italy and other places in the United States, Washington, California. The aggressive measures that they moved to, we decided to, let's not wait for ours to spike, let's go ahead and institute those measures now. And I think we believe that that's going to allow us to flatten that curve, to not have that spike in cases that they've experienced elsewhere. So we've been able to learn from the experience of elsewhere, and we're going to continue to do that. I also, again, want to encourage people to go to the website, the wycokck.org, Unified Government. Get the information about the coronavirus, especially what the efforts we're making here at the Unified Government and by other players in Wyandotte County. And again, I encourage everyone, please reach out to that person next door to you, especially if it's an elderly person that they're shut in, they're locked in, they're afraid to go out. Please give them a call, find out what they may need, and get the information for them and pass that on. That social isolation can be devastating to them and under normal circumstances, but I think now that's even more crucial. So please reach out to your neighbors, those in most need.
Thank you. I think that's going to be all for today, and just a reminder to go to our website, wycokck.org/COVID-19, and we'll also be posting additional information on social media. Thank you.
Thank you.